Welcome back. You're still watching Morning Rush on Metro Television with me, Nanaya Tanobashe, and Desmond Okreko-Danso. Like we mentioned earlier on in the intro, today is World Malaria Day, and we'll be speaking to a company that is embarking on eradicating, eliminating everything that has to take away malaria from Ghana. And we are joined by Bliss PVS Pharma, and we have a rep from them. So he will introduce himself and then we'll start the conversation. Good morning, sir.
Good morning.
What is your name?
I'm Justice Kofiali, pharmacist and medical rep at Bliss GBS.
Okay, you are welcome to the show.
Welcome. Thank you.
Okay,
welcome.
So today is World Malaria Day. It's an interesting one. But then before we delve into the whole eradication, whatever you want to do, I mean, the World Health Organization has set a target to eliminate and take away malaria, at least by 90%. Before 2030, yeah.
Yes.
Such an initiative, when we hear it sometime, we ask ourselves a lot of questions. But then, since you're here, let me find out from you, is it something that is attainable?
Yes, it's a concerted effort. So with the news of a vaccine being available and the fact that we have very effective newer medications and we are still engaging in research efforts to make sure we are not only having effective treatment, we are having treatments that can actually give you prophylaxis. When I say prophylaxis, I mean protecting you for a period of time. And that's basically the job of the vaccine. So when you have these coming together, we know that you're going to achieve this, and it's possible to achieve it. Okay.
And in 2020, the World Health Organization again estimated that 5.3 million malaria cases with 12,500 recorded deaths are still in the country, and we are trying to work towards eliminating it. I will ask, what are we still doing wrong? Because over the years, I know your company has been doing a lot to eradicate malaria, but then what are we still doing wrong as people, as citizens in the country?
So we've come far in terms of the fight against malaria, but then there are some challenges, and that is part of the reason why we have the initiative from our company. So one of the issues initially was access to medications. So FDA together with the Pharmacy Council did a lot in terms of regulation or moving some of the medications from only prescription-only medication to OTCs. When I say OTCs, over the counter, just walk into the pharmacy. And then once they can confirm you have malaria, they will give it to you. That has helped us a bit. Then there's the issue of the rural areas. They are the ones that are having the biggest issue of mortality. So once we are able to tackle more of those areas, we know that we are going to be better at this fight. Aside that, there are a lot of things that some companies are doing, and especially Bliss GBS. So with these donations and things we are doing, education of health personnel, we know that we are giving them all the artillery they need to fight and to make sure we are at a better position in terms of the mortality rate.
I think that if you say we have come a very long way, well, I'd argue that. Because like the mortality is still there. I mean, it was when I was living here where malaria, something like that.
Let me give you some shots. Like for example, before this FDA Pharma Council moving some of the medications into OTCs, it was very difficult to actually access malaria medicine. I'm sure you can actually walk into a pharmacy and get malaria medication. And that increases or reduces the chance of somebody dying by malaria, even just by doing that. Aside that, this treated nets that's coming from the WHO, from NSAID, and other bodies, it's all adding up. So there are also things like repellents, both chemical repellents, electronic repellents, and these are all in the system. So they are actually putting us at a better place. And aside that, as I said, mortality most of the time goes with inaccessibility to the fact that medication. So
I think he has convinced me a little bit. That we've done some great work with respect to that. So it is in view of that I heard that we've got some sort of solution
Yeah.
to it now. And I think that if you could just take us through what exactly that is, because I know Ghanaians, some of us are very skeptical when it comes to vaccines
Yes.
and
Yes.
things like that. So if you could just take us through that.
So with the vaccine R21 Matrix M, that's the name. It has a promise of around 77% in terms of efficacy.
Okay.
It should be noted that even though it's 77, it is still in the bracket of efficacious medications.
Okay.
It's not like it's not good.
Okay.
We should understand that even with 100% efficacious medications, we can still have what we call breakthrough cases, and that is another thing that people actually worry. So if I have to take a vaccine, at the same time get sick, then why is the essence of taking
taking
a
the
vaccine?
vaccine?
So it should be understood that there are breakthrough cases, and that is the reason why I said it's a concerted effort. You can't just say vaccine and then put everything aside.
Okay.
True.
I can assure you that our company has lots of medications, and we are working on lots of medications to make sure that we have enough of these efficacious medications in the system to be able to take care of these not only breakthrough cases, but then take care of special cases. There are some people who take some malaria medications today, and they'll be okay. And in a matter of some 30 days time, they get another malaria new.
Comes back. Yeah.
Yes. So we have medications that can actually take care of such situations. So with that in being available means it's going to be a good thing. I mean, we are assured that vaccine plus these medications
would work. Yeah.
On a day like this, World Malaria Day, what does it mean for Bliss BZS, and what are the activities, what are the plans put in place for a day like this?
So already we've done some donations. We've done what we call health talks in several universities and places around the country. Donations worth 100,000 Ghana cedis to 9 different hospitals all across the country. It's a big thing. These are mainly anti-malarials.
Okay.
So we know that we are equipping the hospitals with what they actually need to fight the malaria. Having these medications there, as I said, is a key thing. So from Wa Regional Hospital to Upper West, Wa Regional Hospital to Tamale Teaching Hospital to Konfanoche to Kolebu to Koforidua Regional Hospital to Ifea Kwanta to Mitabetin Cape Coast. All of these hospitals are being given to, and these hospitals have directories. They work with a net of hospitals in their locality. So they are not only going to be the beneficiaries of these medications, they are going to push them down to this stream of directories, and they are also going to benefit. And these, I should say, are very impoverished, kind of. Okay. So doing this activity is a big win for us.
Okay.
Big win. So what's the collaboration like from your company, Bliss, I'm sure the malaria control program to the Ghana Health Service, the FDA? Tell us the collaboration amongst all of you to make sure that we are eradicating malaria from the country.
So all of these programs, most of the time they are designed based on research and some other things, but they also need companies who are willing to invest into the research and then are willing to take the initiative of some of the things we've done, just like the donation, because they need these medications. They have to procure them and then also help push into the system. So we have, as I said, with a collaboration with them, we have provided, for last year like this, we provided the Ghana Health Service, Ministry of Health, with sets of medications, what's in the hundreds of thousands of Ghana cedis, and they are already in the system. So we are in this concerted effort with them to make sure they have the continuous flow of these medications.
Okay.
All right, Justice, it's been a very insightful conversation with you about malaria. Nobody likes malaria. I remember the last I had one, though, but when you have people close to you who have malaria, you cannot eat. Papa. So we all need to, it's a very difficult thing. So we all need to come together and make sure that we push malaria out of the country. So Justice Yali is from Bliss GVS. Any other thing you want to add before we wrap up on our conversation?
This thing we are doing is coined in the term Arts for Africa campaign. Okay. So the Arts for Africa campaign, as I said, it's not only donation, it's not only medical awareness, but then we are trying to help with the fight, and the fight is a big one. So we would encourage that with these educations and all of these things, we also have social media handles at For Africa.
Okay.
That's the name.
That's the name.
Twitter, Instagram, Facebook. You can follow, you can look at the activities we are doing, you can follow some of the statistics there. The information put there will go a long way to educating the masses too. So they should also go to there and then
go get all that information. Thank you very much for joining us this morning as we talk about Malaria Day.